Well, good afternoon, everyone. First of all, let me thank you for joining us today. I also want to acknowledge Dr. Kathleen Toomey, who's with us as always, Dr. Vic Kapil, who is the Chief Medical Officer for the Department of Public Health. Vic, thank you for being with us today and appreciate both of y'all's work on the vaccine distribution and also continuing to fight COVID-19. General John King, our insurance commissioner, who is leading the vaccine distribution task force, is not able to be here today, but I certainly want to thank him for all his efforts in recent months as we've taken the fight to COVID-19 and made plans to deploy a safe and effective vaccine. Today I'm going to be brief so that Dr. Toomey can walk through some of our planning that our teams have been working on the last few months related to vaccine distribution. Our top priority has been to deliver whichever vaccines were approved to the people of our state in a safe, efficient, and coordinated fashion. Last week I held calls with our leaders of the nursing home industry and our hospitals to walk through their coordinated efforts to combat COVID-19 and ensure that these critical institutions had the supplies, manpower, and resources necessary to continue this fight throughout the winter months. I was also able to speak with representatives from CVS who are working hand in hand with Operation Warp Speed to serve as a linchpin of the federal disbursement strategy nationwide. I want to take a moment and just say how grateful we are to Operation Warp Speed and the Trump administration for this unprecedented and incredible achievement. The public-private sector partnership working together has developed a miracle of modern science that will save countless lives in the days ahead. Dr. Toomey is going to provide an overview of our strategic plan here in just a few moments, but I wanted to stress a few takeaways real quick from today's briefing. Number one, yes, we will have a limited number of vaccines that will be distributed within Georgia in the next week to 10 days. However, and this is critically important, our first shipments will not be anywhere close enough for anyone in our state to stop following the same public health guidance that we've had in place for many months. The limited amount of vaccine doses we will receive in the coming days will be going to the most vulnerable and those on the front lines of fighting COVID-19. That means residents of nursing homes and our healthcare workers. The general public will not be able to be vaccinated for months. We must all continue to still wear our mask. We must still wash our hands. We must continue more than ever to watch our distance. Our executive orders have remained virtually the same for months now. We have been able to successfully balance both lives and livelihoods. Georgia businesses have been allowed to resume operations, and people have been allowed to exercise their constitutional freedoms. Not every state has taken this approach, and my plea to Georgians is this: to keep Georgia open, to keep hardworking people employed, to keep food on the table for thousands. Please follow the guidance that we've been preaching for months now. These simple steps have been proven to work. No government mandate is going to get rid of this virus. Individual Georgians stepping up to the plate who will slow the spread of 19. That is what I'm asking everyone to do. I fully realize and appreciate how tired everyone is. Everyone wants to go back to the normal Georgia. I understand that. Our public health workers have worked long hours. Our nurses and doctors have been taking long extra shifts. Our teachers have had to adapt to drastic changes in their profession as well as the rest of our educational leaders. And too many parents have had to figure out a way to keep their kids' education on track, all the while still figuring out how to pay their rent. Waiters and waitresses, hospitality workers, and countless other hardworking Georgians have had to take fewer hours or find a new career altogether. This year has brought unimaginable hardship, but it is my belief that we have lost too many loved ones, too many friends and neighbors to give in to this virus. Too many businesses have gone under, and too many families have literally lost it all. We cannot give up now. We all must do our part so that the sacrifices that everyone has made will not be done in vain. This long nationwide nightmare will end. The vaccine is on its way. Therapeutics, as we know, are getting more plentiful by the day. And I'm asking everyone to continue to hunker down and do a few simple things for the next few months. Wear your mask, wash your hands, practice social distancing, and continue to follow the public health guidance that we've had in place for a very long time. Remember that we are all in this together, and we will get through this together. And I'm confident that our best days are still ahead of us. So thank you, and God bless you, and I'll now turn it over to Dr. Toomey.
I'm attached to my mask. Sorry. No, thank you, everyone, for being here, and thank you, Governor, for your leadership. I'm very happy to be here today to give some good news about COVID to everyone. We have been working on our strategic plan for the vaccination program for more than several months. We started early on using our pandemic flu plan and built on that with the public health system as the foundation of that plan. And we did that because the infrastructure is in place to be able to deliver the vaccines efficiently and effectively, and then building on not only our 159 county health departments, but also our partnerships with hospitals, with private sector providers, and many other providers throughout the state. I think it's really important to recognize that the whole process is changing literally daily as we're getting more and more information from the federal government. The amount of vaccine we will get will likely be, at least initially, over several 100,000 doses, although that may change. And we will be getting that in several tranches weekly, but we may have additional available. So I'm not giving you an exact number because I expect that those numbers may change over time, and we actually may have additional vaccine available depending on kind of overall national supply. The other thing I thought was important to emphasize is the fact that with the limited vaccines initially available, we felt it was very important for us to follow the ACIP guidelines. That's the advisory group to CDC on immunization practices. ACIP is an independent organization. It's not a government entity, and it looks at not only the science but all the ethics of who needs to be vaccinated first. And we have chosen to follow ACIP here in Georgia rather than kind of go on a separate course. And I think that will allow us to provide vaccine initially to the most vulnerable, as well as those who are most at risk because of the work that they do. And so following ACIP guidelines, this initial tranche of vaccine that becomes available in the next several weeks will go immediately to healthcare providers working through largely through the hospital system as well as our public health system, and long-term care facilities, both their staff as well as the residents, recognizing how many individuals have been affected in those facilities. In the next round after that, we hope to not only address the needs of essential workers, including, for example, nuclear power plants, the power facilities, those individuals that keep our state running, as well as older individuals over 65 with multiple health conditions who may be at higher risk for complications. But we have to wait for the ultimate guidelines to come out from CDC, and they'll be coming out in the weeks ahead. We expect to have both a combination of the Pfizer and the Moderna vaccine. Again, there are two different vaccines that we hope will become approved by the FDA through an EUA, through an emergency use authorization in the next several weeks. The Pfizer vaccine requires minus 90 freezers. We have those freezers available all over the state. I have identified them as well as have purchased them within public health and have worked out a mechanism to transport vaccine even without the freezers through special carriers that Pfizer has provided in partnership with the vaccine program. The Moderna doesn't require that those deep freezers, it's a regular freezer, and so that'll be easier to transport. We'll be working in partnership with the Georgia State Patrol to transport that vaccine to the various facilities, whereas the Pfizer vaccine will be transported directly to hospitals, for example, that may be providing those vaccines to their healthcare workers, and we'll be able to provide more details on that if you're interested. I think one of the things that is particularly important to emphasize is that communications about these vaccines are particularly important. Communications because there's 2 doses for both of the vaccines, whether it's the Moderna or the Pfizer vaccine, both require 2 separate doses, either 3 weeks or 4 weeks apart. That means not only do we have to have the system in place, which we do, to track and monitor and call individuals back, but to make sure that people will be willing to come back for that second dose. We want to be absolutely transparent about the fact that often that second dose, or even with the first dose, there may be some side effects of the vaccine that are short-lived and not a difficult thing to deal with, but it may discourage people from going back to for the second dose, including mild fever, pain in the arm where the vaccine was administered, or even some flu-like feelings. Again, being very transparent, I think that's something that we need to communicate about. That's to be expected. It's not a complication. It's not a problem that needs to be worried about, and that we need to take that into consideration as we're vaccinating healthcare providers and others, that they may miss a day of work after those vaccines. The other thing that I think is extremely important, and I have mentioned this before, even as we did our planning for this for months and used our influenza vaccine campaign as a model of how we would roll this out, is that many, many people are hesitant about vaccines in the state anyway. And I heard someone say on the radio the other day that this is the only vaccine that's had its own anti-vax campaign begin even before a vaccine was produced. And I think that's a challenge that we have, because we have to reassure everyone that this vaccine is safe, effective, and there's good science behind that. And many, many people in my own community, my neighbors, my friends, my relatives, both here and out of state, have said to me, are you getting the vaccine? And I can say with great enthusiasm, I can't wait to be vaccinated. I'm so looking forward to that opportunity, and I hope that we can convey that same desire to people throughout Georgia, because until we can vaccinate as many Georgians as possible, we will not have the level of immunity within the state as a whole to prevent continued spread. And I think that is an important thing to say. I think the messages will be particularly important in African American communities where there has been a disproportionate impact of COVID on those communities and disproportionate complications. We really want to ensure that our communication messages focus on the concerns and the good science that's there, that we feel very confident that these vaccines will work, are safe, and are important to ensure the safety of all Georgians at this time. The final thing is to say that I hope that we can continue to communicate about this as we roll out our vaccine plans. There's many things will likely change. We will have to be agile because on the federal side, a lot of the issues, particularly the vaccine, numbers of vaccines are changing and increasing. The exact quantity of vaccine, the exact type of vaccine we're going to get has not yet been clarified. We will clarify that as soon as we have that information available, and we'll share that with you on an ongoing basis. I expect to be communicating with you regularly throughout this process so that we not only have the most accurate, up-to-date, transparent information available, but that also we can ensure that people feel comfortable with this vaccine program, and that we can encourage as many people as possible to be vaccinated when the time comes and the vaccine is available to everyone. We expect that this vaccine will continue through this year. Probably not till summer will we have everyone vaccine for everyone throughout the state. But throughout that time, the other message that I need to convey, as the governor laid out, is we can't give up, we can't get tired, we can't give up the continued attention to all those simple safeguards that will keep us safe during this time, even as we're working to ensure vaccine is distributed throughout the state. And wash your hands, wear a mask, social distance, follow the guidelines for gatherings. Looking forward to Christmas ahead, again, that could be another opportunity for us to try to prevent new cases as we protect our families, as we did at Thanksgiving time. And the last message I can't forget is get a flu shot. It's not too late, even as you're waiting for your COVID vaccine, to get your flu shot. It's not too late in the season. We are so far seeing a very mild flu season. I think part of that reflects the fact that everyone is following the guidelines more effectively than we had in years past. But it's important, again, to protect our hospitals and to continue to protect our communities, to ensure that we have the least number of flu cases this year as possible. As we approach nearly 500,000 COVID cases in Georgia, at the numbers I looked at today, I think it's really important, again, to emphasize how these basic measures will need to be continued to be followed even as we roll out this vaccine campaign with unprecedented speed and good science behind it. And before I turn it over to the governor for questions, I just want to say I want to again thank not only our medical partners, the hospitals, the providers who have been working with us diligently, as well as the long-term care facilities, and the pharmacies, CVS and Walgreens in particular, who will be partnering with us on long-term care facilities. I also want to say many thanks to our public health, our county and district public health officials who have been working with us from day one, who will continue to provide testing during this time, but also will be really the foundation of our vaccination program. That's a lot of basic information, and I look forward to answering questions. But before I do, I want to introduce someone to you. If he'll stand up, Dr. Vic Kapil is our Chief Medical Officer. You haven't met him yet. He has joined us, like myself, had 20 years plus at CDC, a long history of leadership at CDC. We're so grateful that he has joined our team and is over the medical programs, including our vaccination program, and can help guide this along with me. So thank you, and thanks for being here. Do you want to come? Yeah, I'll just leave my numbers.
Well, thank you, Dr. Toomey, for that update. Thank you for your continued leadership. I would just echo as well as I did earlier. We're glad to have Vic on the team, and we are all continuing to work hard together on the vaccine distribution, but also continuing to fight COVID every day. And with that, we'll open it up for questions.
Great. This is Sam Whitehead from
Go ahead, Sam.
Yeah,
Sorry.
Sam Whitehead from WABE. Thank you, Governor, as always, for taking questions. You know, we've seen over the last number of months our number of cases slowly start to rise here in the state, and you and your office have declined to put any additional strong public health measures in place. I'm just wondering, reflect on that if you could for me. I mean, you say the state is doing all right, you say we want to protect livelihoods as well as lives, but how do you think your approach has been working so far if now we're at a place where we were this summer, where cases are high? I was on this call with the hospitals. They're concerned about bed capacity, staffing. Just reflect on the situation for me if you could.
Yeah, so let me just give you a little update. And obviously, we've been following the numbers daily. I mean, our cases are going up. All of our metrics are going up, and certainly our hospitalizations, which is the one number that I continue to watch as much as anything. We've had great conversations, as I mentioned earlier, with our long-term care facilities and our hospitals. You know, we know and have been talking to them about staffing. We're also working with our partners in Washington about the CARES Act funding ending 12/31, which creates some issues with potential additional staffing resources. So we're working and planning through that as we speak. You know, I think there's good news here, and then there's not so good news, right? If you look, and I did last night, and we talked about this morning, the cases per 100,000 comparing all the states and territories, I mean, we're like 44th, or we're way down the list. So we're faring much better than the rest of the country, which I think is a good thing. The bad thing is we know that we've got something going on right here, you know, and it started actually, I believe I'm correct in saying this, a little bit before Thanksgiving, which is why, you know, Dr. Toomey and a lot of other people, and including myself, really urged people to be careful over Thanksgiving. And I believe that most did. But I also think, as on all these holidays, you had some people that let their guard down. We're obviously seeing more community spread now. I would urge my fellow Georgians, if there's an activity that you don't have to do that involves being around a lot of people, don't do that. Continue to follow the guidance that I know I mentioned at least 3 times in my short remarks about masking, distancing, follow the health guidelines. We're continuing to stay in touch with our hospitals. I will say this, with the increases we've seen with our hospitals, we don't have near the panic, if you will, that we had early in the pandemic, because we have better treatments, we got better therapeutics. We're better managing that just because of what we have learned with the virus. So I feel good about that. I'm definitely concerned about those numbers. We're watching them closely to see what else we can be doing like we've done in the past. We have our surge capacity bed plan. We're continuing to work on the movement of patients if that's needed through the coordinating center at Grady. I want to thank them. As well as the General Assembly and our state leaders for supporting the funding for that. That is something that has served our state very well. So I feel like we're in a good spot, but it's like I said in my remarks, it's going to be our citizens that flatten the curve by using best practices, doing things they don't necessarily have to do. And when you look at our outbreaks on the report that I read this morning, from the health team that we have, we're seeing those in some manufacturing type businesses. We're seeing those in some of our schools, and then in other places like churches and other things. So, you know, we're not seeing, and we had less, I hate to say super spreader, but we had less of those big type events that we documented this week than we did last week. So I took that as an encouraging sign, but there's still enough signs out there that give me grave concern, and that's why I want to ask everybody to continue to do their best to help us be part of the solution, not part of the problem. And our businesses that are open and able to pay people and provide to our economy, which has been so strong, we need them to make sure that they are continuing to follow the guidance and the guidelines that we have in place. Those things have been working. They worked in the past. They'll work now, We've just got to all make sure that we double down on that, even if it's just for a couple of weeks to get us over this hump, and then we can regroup as we go into Christmas and Hanukkah and other holidays.
This is Andy Miller, Georgia Health News. I had a couple of questions for Dr. Toomey, if that's okay. About the vaccine, right here.
Sorry, hey.
That's all right. The several 100,000 doses you talked about, is that going to be enough to cover those healthcare workers?
No. Oh, nor will it be enough to cover the long-term care facilities. We know that.
So how are you going to distribute them with that challenge that you just talked about?
I mean, we are working with the hospitals themselves. They are ordering vaccine. We have been talking with them and will continue to have communications with them about how to prioritize their own workers within that priority population. That some individuals within hospitals are more at risk than others. For example, a respiratory therapist, someone in the COVID unit, the ICU, will be more at risk than others who may not be exposed to COVID constantly. But we will continue to work with them and continue to roll out the vaccine as it comes in, so that we hope by the certainly early January, I would think, that we would have all healthcare workers covered. And we'll be agile with it. We don't know whether we'll be getting Pfizer, Moderna, in what proportion, but we will just go with it, what we get, and very quickly get it out to the providers, and they're ready to accept it and ready to go. I mean, this is something that we have planned and have actually exercised. We've done several emergency exercises, even in the last several weeks. We are doing another tabletop tomorrow. You know, people are primed and ready. The providers are ready to go. So I don't think that there's not going to be a problem of vaccine wastage. I think there's going to be, we're going to get that out. The one thing that you can help us with is to ensure that we get demand. I get feedback even from providers that there's still concern about the vaccine safety. And I can't emphasize enough how confident I am in looking at the data, and even the new data that was available today, that this vaccine is safe. No question it's effective, and that it will be a game changer for us in Georgia once we're able to immunize not just the healthcare providers and long-term care facilities, but everyone in the state.
So will providers make the call in terms of who gets vaccinated within their facilities?
I mean, the individual, they make the distribution requests. It's in the end, it's our state public health immunization team that makes the final call about where the vaccine goes. But within the hospital itself, they make the call, but we make some recommendations about who gets it within those facilities.
Will rural areas be more of a challenge getting the vaccine to them and distributed versus, let's say, Metro Atlanta?
No, I think because of how we've worked this out, both through pre-positioning of vaccine, the freezers, as well as our partnership with the National Guard, we'll be able to get this throughout the state. I'm very confident of that. And the fact that all of our health departments, every single one, 159 health departments, are part of this activity, they will be, in a sense, really critical to ensuring that we get the vaccine to everyone, and no matter how remote the area. And I think I've answered the question. I just think that I'm very confident about that, unless, Vic, you want to answer anything else?
Good morning, Riley Bunch with CNHI News. This is probably for Dr. Toomey, but Governor Kemp as well, I'm sure you can chime in on this. Piggybacking on Andy's question, what is the state's strategy to make sure that marginalized and rural communities have equal distribution of that vaccine throughout the distribution process? So not just this first round, but until everyone's vaccinated.
No, we are looking at population, but we're also looking at request, and our public health directors are really in charge of how this is being done, so they are looking out for their rural areas. So it isn't as if we have a metro focus. We have a statewide focus with great advocates for rural areas, and we'll ensure that we have adequate coverage for everyone. I think it's something I feel strongly about. We're having, our surge right now is not a metro surge, it's a statewide surge. So everyone throughout the state needs this, including those providers in rural areas. So we will be ensuring through the mechanisms of vaccine delivery and the coordination with public health, ensuring statewide coverage.
There, Nicole Carr with WSB. We talked about the state's standing as compared to others in the country, and we've also talked about when we add our antigen cases in, what our outlook looks like. In wanting to preserve economic stability, is there a point, do we have a metric where we go into stricter guidelines? And if not, with citizen responsibility, do we ever go back to daily briefings and to talking to the public every day and hammering in what we need to do?
Yeah, sure.
Well, I would just tell you that we watch the numbers daily. You know, we're not setting some number over here 2 weeks from now and then try to figure out what that looks like 2 weeks from now. I think we've seen in the past people that have done that. It boxes them in. It does not allow them to be flexible. The best thing that we have going for us are these two people right here. There's nobody in the country, I think, that has as much experience as they do in public health, dealing with these type issues, and they're doing a great job. So we're going to continue to make decisions on data and science and where we are with our systems, which is why I stay in constant contact with our hospital CEOs, just not in Atlanta, but all over the state. We're going to continue to do that. You know, same for our nursing homes and other facilities that are out there. To just add one thing to the previous question too on the distribution and where it's going to go in the rural areas. I know I've spoken directly with General King at least twice about that. You will see in the coming weeks and months that he will be, as well as Dr. Toomey, Vic, and myself, continuing to talk about this, so we're transparent with the public. The public is engaged and informed, but I know General King has made it very clear that we got to get the vaccine out to all parts of our state. We don't want anyone to be left out in this endeavor, and he will be on the road, I can assure you, a lot, messaging that, not just to, you know, Atlanta and other metro TV stations, but to local newspapers in small towns that many of us never see every day, to make sure our citizens are informed and know that these protocols and procedures and distribution that we're putting in place applies to everyone in our state.